and welcome to The Courageous Survivor. This is going to be a very interesting podcast because there's been a lot happening. So it is October 10th on Saturday. So it's Thursday. On Saturday, I received a new concussion and I'm symptomatic from it. It was a work injury. And so transporting in the back of the squad, so I'm a paramedic, transporting in the back of the squad, emergent traffic had, my patient had a change in condition. I had to stand up to start fluid. Shortly after that time, while I was standing up, somebody pulled out in front of us and the driver had to slam on the brake and I went flying and hit my head kind of sideways. Got launched from kind of the middle of the squad up to where the cab and the box come together, hitting my head. I knew instantly I was going to be in trouble. Kind of just had instantly that like drunk feeling hit me. And it's been a wild couple of days because it's a work injury. So it goes into workers' comp. And I don't want to do that. I don't want to get sucked into the medical system again. I have lost all faith in that. So I have a known anoxic and traumatic brain injury from a domestic from 2006. From 2006 to 2019, I was misdiagnosed. So over 50 different providers, over $350,000 in medical debt, had to do bankruptcy, lost my job, couldn't drive for a while. It's not that I lost my job. My neurologist said, I don't want you doing this anymore till we figure things out. Then I got told I won't see 50 because I have a really aggressive form of MS. It was medical mayhem. And all of that money, all of that time, all of those doctors, for 13 years, they misdiagnosed me. And so I went to a functional medicine doctor, functional neurology. I live in Northwest Ohio, went to find those providers in Minnesota. And I mean, pretty much got healing. Not that I got healing, I was able to kind of have a lot of neurofeedback, a lot of stuff where I was able to get back to work and really feeling the best I have ever felt in my life. And now I have this. I've been symptomatic. I did not want to go down the workers' comp thing because the Bureau of Workers' Comp, I am learning, has a bunch of bullshit rules. Again, our government is a complete mess. I don't care if people get mad at me for what I'm about to say. The medical system in America is not healthcare. It is disease care. I am on no medications. I am able to live a healthy lifestyle and remain healthy. All of those diagnoses that I got were like labels for symptoms that I had, and they put me on medicines that didn't fix any of the problems. Maybe some of them masked them, but I would have to be on medicines for the rest of my life. So I go to these functional neurologists, and I have been living so great, like feeling amazing. In the first couple of days, like I had a pity party because I was, if you look at my social medias, I cried. I was so emotional. And some of that's the brain stuff, that prefrontal cortex, limbic system type stuff. But I went through like sadness, pity, anger, and I'm like, I am very strong in my faith, and I'm like, oh, I can use this because one of the things that I've been realizing as I've been traveling around is that most people can't afford to be able to do this type of like lifestyle changes in healthcare. And I was kind of developing my kind of own program that like a subscription of YouTube videos and like exercises and stuff that people could kind of like work on at home. And like now I get to work my own program before I launch it. So if it doesn't work on me, then hey, I can't expect it to work on anybody else. So I'm gonna do that, and I'm gonna take people along on this journey. And here's the thing. So I found out. So I called my functional neurologist, and there's this rule that when a provider knows that an injury happened at work, they have to like that has to go through workers' comp. Treatment has to go through workers' comp. That really pisses me off because I don't want to go through the traditional system because that means I'm going to have to go to my primary care. My primary care is going to send me to the neurologist. The neurologist, like, and I'm going to have to get an MRI. And I already have known stuff in there. And, you know, one of the things that I've learned is that not all concussions, most concussions don't show up on CT or MRI. They're going to give me some bull crap, you know, story, send me for testing. They're going to try to say like, oh, here's your MS, because my old neurologist kept saying like, no, you have MS. You can't have symptoms affecting your brain from 2006, you know, and even went to as far as to say I needed a psych consult because I was unable to accept my poor prognosis. He said that he did not care what happened out at the functional, you know, with my functional neurologist, because there's a reason why insurance doesn't pay for that kind of care, because it's not really approved by the FDA, or whoever that governing board is. But like he was just, and he said, he actually went as far as to say it's witchcraft medicine, which is so frustrating. Of course he's old. So that's the whole thing of, you know, those older, I will never see a doctor over 35 again, because unless they are a holistic or functional doctor, because I think that the older generation just is not willing to realize that there's a difference between healthcare and disease care, and they're kind of stuck in that disease care crap. So, so I started calling the Bureau of Workers' Comp. I actually contacted a workers' comp attorney, trying to find out a way around this. So, against a lot of people's advice, I am signing off for workers' comp so that I can get my own medical treatment. Because here's what I know. I know that if I go into the medical system, I'm going to have to see my primary care. The neurology consult will take weeks, if not months. Getting an MRI will take, or a CT will take weeks or months, all while I'll have to be off work. Which, yes, I can get short-term disability at 60%, but I don't, like, I want to work. I want to like have my life back. And I know how good and easy it will be. Not that it's going to be easy. I shouldn't say that, because it's going to be a lot of hard work. I'm going to have to really tighten up the ship and my day-to-day, hour-to-hour decisions of my life right now. But I know, worst case scenario, I go out to see my functional neurologist for 1 week and I'm going to come back a completely different person, because I know it works. I'm going to try. So I did speak to him. I'm probably going to see if I can have a virtual appointment before, just so I can kind of gauge where I'm at, and then like at the end. But I'm going to try to do a lot of this at home by myself. So I've taken a week off work. I have plenty of vacation time, so I'm taking vacation time, and I'm going to work my tail off at home. I'm going to do the program, and hopefully it works for me. I am implementing, so I'm implementing fasting again. I'm putting my supplements back in, doing a lot of brain stuff. I'm going to be, per some conversation with my functional neurologist, I'm going to add a couple of things back in that I've not taken before, but that are good for brain health. Going to start doing the very basic of what I did at the clinic. So while I was there, last time I was there was in 2022, I was able to buy almost everything. And so I'm in my little office. I do my podcast on one wall, and then the other side of the room is like all brain health, eye stuff that I use for my rehab. So I'm going to work my tail off and get back. And I am confident. So I am off till next Friday. So I am off the next 8 days, and I am 100% confident that I can work hard enough that in the next 8 days, I will be back to almost 100%. And you know, there's people at my work and friends and stuff that are like, you shouldn't do that. But what if? Here's the thing. If I go back into the traditional medicine program, which I'm going to have to do because there's like certain doctors you can see and blah, blah, blah with bureaus of workers' comp. One, my doctor is in Minnesota and he's functional neurology. So they are never going to approve him. So I am never going to, through workers' comp, get to see him. Learned that from speaking with workers' comp and speaking with the attorney. So that means I'm going to get stuck in this system who will most likely, because of the stuff that's already in my chart, I think it will be career ending. And I am telling you right now, this Paula is probably still better than 75% of the people that I work with. Like when I say I feel amazing, if I don't have headaches, I don't have joint pain, I don't really have bad days. And if I do, it's related to either A, I ate something that I'm not supposed to eat, so gluten or dairy, which causes inflammation, because if you have a brain injury, a lot of times that brain-gut alignment gets messed up. So that's when I'll get like gassy, or I'll get bloated, or I start getting brain fog. I'm tired. So I work as a paramedic. If I do a 24-hour shift, or I go in and work a night shift, if I'm up all night, if I've been traveling a lot, like fatigue. So stress, you know, stuff with my crazy family, or stuff like that. Like I can tell exactly why I don't feel good. And then I can fix it. And within 2 or 3 days, I am right back on to 99.9, 100%. So it's that, like I get super, super, super picky because I know what it feels like to feel truly well. I never knew how, I didn't know how sick I was until I felt well. That is the amazing thing about that functional medicine and making lifestyle changes. People eat gluten and dairy, and they don't exercise, and they don't go outside. They don't, do grounding. They don't practice self-care. They don't, meditate. They don't exercise. Like they just don't do these things. And so they don't know how bad they really feel. Like we in America have become accustomed to not feeling well, to having mental health problems, to having chronic illness, to having all this, like that is what the traditional medical system does to us. And it is absolute horseshit. But people don't have joy and happiness and goals. Like it's like being able to have long-term goals and stuff like that. Like people can't think. Like the world's a mess, and I'm not going back to that. I was there. I will not go back to that, even if that means taking a risk and signing off the workers' comp. And that's what I'm doing. My boss tried to, like, he did a great job. He tried to talk me out of it. Nope. I'm putting it on my podcast and I'm putting it out, like, no, that is how much I don't trust our medical system. I was trapped in it. And I am telling you what, I have serial dated and picked abusers. Picked some good ones. I had some good guys, but I picked a lot of bad ones. And I'm telling you what, the hardest abusive relationship that I've had to leave is the one with my doctors in the medical system. It is almost impossible because they get you. It's verbally abusive, it's emotionally abusive, it's financially abusive, it's spiritually abusive. Like, that system sucks the living life out of you. And I will, no, if I have a stroke, I have a heart attack, need a cast, break a bone, I'll go to the ER. But other than that, I will not do it. And like, as a paramedic, I mean, not only my own story, but I see it time and time again. We take the same people over and over and over. You take them to the ER, 6 months later, you have to pick them up. They're still having the same problem. Well, I haven't been able to get to the specialist yet, or, they put me on a med, but it's not working, so they've increased the meds, blah, blah. It's absolute crap. Our food is making us sick. That's one of the things that I'll have to tighten up, I'll have to tighten up right now. I try very hard to not eat anything out of a can, jar, box, like no processed stuff. I try to get everything fresh or frozen. I try very hard to buy only locally grown meat. I try to buy from our farmer's market. Like, I just try very hard to buy organic, and just live a very, like, yes, it's more expensive, but what I save in healthcare. Matter of fact, I've gotten to the point where I've decided to not pay for my insurance. I'm not going to carry insurance. I will buy into a co-op with, or not a co-op, but like into a program with holistic healthcare providers, because I won't do it. It's a trap. It almost led that being sucked into that life and feeling hopeless and feeling that life would never get better is what drove me down the very dangerous mental health area, to where I was ready to take my own life. And I think that there are a lot of people in America that are doing those things. They're taking their own life because they feel like they can't get out. I unfortunately have seen where people have chronic illness, chronic pain, losing everything because of being trapped in the medical system, and they are committing suicide. Seen it as a paramedic, seen it as a friend, and that's horrible. That is absolutely horrible. So this will be posted today on the 10th of October. So watch, if you were watching my social medias and my YouTube channel, I'm going to be having lots of videos kind of showing where I was and showing my progression through my rehab, and showing the videos, like what I'm doing, what supplements I'm taking, and hopefully I can show people the benefit of, understanding and going to holistic or functional health, because you learn to take care of yourself, because it's not going to a provider and getting prescriptions that you have to get from them. Like, they educate you. Not only do they help treat you, but they educate you so that you can take care of yourself. And so now I really get to show people the value of what I learned working with, Dr. Reese and Dr. Hennis at the Neural Connection. Because here's the thing, even if I have to go out there, because people are always like, it's so expensive. So my insurance had an $8,000 deductible. If I go the traditional route, I am going to have to do a regular doctor visit, a specialty visit, I'm going to need either a CT or an MRI. And that's just the very beginning. Not to mention, I will only get 60% of my wages, and that will probably take me about 6 months. When I started looking at the cost of that stuff, because this is how I am, I'm researching, I could literally go out to see Dr. Hennis, do a week of therapy, and it would be cheaper. And I will only be, I'll be back to work in a week. So sometimes when you look at the cost, you gotta look at the big picture. We get so stuck on, so I weighed out all of my options. This is what I'm choosing to do. And I look I'm looking forward to taking you guys on this journey, because I was in the pity parking lot when I first hit my head, and I think that God is in everything. Like, he allowed it to happen. And maybe this is why, to be able to show how much I've learned, how I do have something to help others. And maybe it's to show just how important it is for other people to really work on wellness, because when you are well, like holistically well, your recovery time and everything is so much easier. So I look forward to next week's podcast, and for you to look at my social media. I'm either under the Courageous Survivor or Paula D. Walters. And I hope that you join me and see how amazing this journey is going to be, because I took a risk, and I am 100% confident that in 8 days I will be a whole different person, back to work, and not regretting this decision at all, because it's just, that's the whole point. And I'm not getting trapped in that system ever again. So have a wonderful day. Thank you, and be blessed.